before you go for your iron infusion appointment as a pregnant woman, I will advise you watch this video and stay informed. Good day everyone and welcome back to Nurses Lecture Room. My name is Mercy Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. And today I'm going to be talking about iron infusion. Yes, we're going to be talking about what iron is. What is an iron infusion? We're going to be talking about the benefits of having an iron infusion in pregnancy. I'm going to be telling you the risks and side effects of having an iron infusion. And I'm also going to be telling you why the doctors are suggesting you have an iron infusion. And I'm going to be telling you what to expect when you go for your appointment. All this in this particular video are going to be based on my experience as a pregnant woman that had iron infusion during her pregnancy. Now, let's talk about iron in pregnancy. Iron is very essential in pregnancy because it supports the increased blood volume of the mother and ensure adequate oxygen supply to the mother and the baby. Remember, you were just one on your own and all of a sudden you became two. So your normal blood volume will not be able to carry both of you. So we have to increase your blood volume. So if you have adequate iron in your body, it's going to help support that increased blood volume during the course of your pregnancy. However, some women develop iron deficiency anemia that can lead to dizziness, fatigue, and shortness of breath. It can also lead to complications such as preterm birth and also low birth weight. Now, let's talk about iron infusion. What is an iron infusion? An iron infusion is a procedure in which iron is delivered through an intravenous cannula into the bloodstream. Yes, it goes straight to the blood. It's not like tablet that you need to take and it has to follow different processes. So when it gets straight to the blood, it quickly increases your iron level. It quickly replenishes that iron deficiency. And when that is increased, it's increasing your red blood cells production. And when your red blood cells production is increased, definitely there's going to be an easy transport of oxygen to the mother and also the baby. Then the next question is, why do doctors suggest iron infusion for pregnant women? One, they suggest iron for pregnant women because the woman might be having severe anemia. Yes, if a pregnant woman is having severe anemia, especially anemia related to iron deficiency, the only option for the doctor might be to give an iron infusion. Then the second reason is the doctor needs to quickly boost your iron level before delivery, especially if you are in your third trimester, 37 weeks, 36 weeks. They see that, okay, even if they give you tablets, it's not going to quickly boost it before delivery, and they want your hemoglobin level to be at a particular level before you push the baby. So they might give you iron infusion at that particular point in time. Then the third reason is you are taking your folate, you are taking your folic acid, you are taking everything, giving the tablets in regards to boosting your iron level, but yet it seems not to be working out. The doctor might suggest an iron infusion. And another reason is you are reacting to the iron tablet. You are reacting to the folate, you are reacting to the folic acid. The doctor might advise you take iron infusion. Then also, if you are having underlying medical condition that is affecting your iron absorption, that is, even if you take the folate, even if you take the iron tablet, it's not working because your body cannot absorb it. It might give the doctor no option but to tell you to go for an iron infusion. So now, let's talk about the benefits of having an iron infusion. One of the benefits of having an iron infusion is that it works very quickly, unlike your oral tablet that it needs to take time before your iron level is boosted up. But with iron infusion, it works really quickly compared to your tablets. Then another one is better tolerance with fewer gastrointestinal side effects. You know, when you take iron tablets, you're going to be having some people react to it. Some people have a lot of side effects associated with it. But when you take an iron infusion, it is better tolerated and you have less gastrointestinal side effects. Then there's reduced risk of complications when you have your iron tablet. It reduces your chances of giving birth to a preterm baby and a baby with low birth weight. Then another one is that when you have the iron infusion, you experience an improved energy. You see yourself having more strength compared to when you've not had that iron infusion. Like I earlier said, I actually had the signs of dizziness, weakness, fatigue, but immediately I had the iron infusion, days after, I started seeing the impact in my energy level. I started seeing the impact in the way I do things. So these are the benefits of having an iron infusion. Now let's talk about the risk and side effects. It's generally safe to have an iron infusion, but in terms of the side effects, you might experience headache within 24 hours of having it, probably nausea and vomiting, which is rare, increase in body temperature, which is rare. Then also what is rare is like an amount of the iron-rich fluid might leak into the skin, causing discoloration of your skin. It is also rare, and some complications may arise, such as anaphylaxis, people reacting to the infusion, anaphylactic reactions. So that is also rare. It's part of the side effects associated with having an iron infusion, but generally it is safe. Okay. So now let's talk about what to expect and also my experience in regards to the iron infusion. All right, before the day of the iron infusion, I got a call. I also got a message in regards to my appointment and a reminder. I had it at about 9:30 a.m. in the morning. So on getting there, my vital signs were taken, and also the baby's fetal heart rate was checked just to make sure everything is fine, and also for them to get the baseline. So a midwife came across to explain the side effects associated with having an iron infusion, which I already stated in the particular video, and was like, "Are you happy to have it?" They asked if I had any allergic reaction, and I said none that I'm aware of. Then afterwards, they went to go get the infusion. But before the infusion came in, they had to insert a cannula. Remember, it's not taken orally, it has to go through an intravenous cannula. So they inserted the cannula into my hands and they brought the infusion, and as usual, they will ask for your name, your date of birth, just to confirm that you are the right patient. And afterwards, the iron infusion is set up. So the iron infusion usually lasts for, like, let's just say highest 1 hour. It lasted for 1 hour. Yeah, 30 minutes to 1 hour. The infusion has already run through. And they usually calculate the amount to give you based on the severity of your anemia. I think they use age and also your weight just to know the amount of iron infusion they are going to give you. So after the whole infusion, I was asked to wait for a particular period of time, but my cannula was still in my hand. I waited 60 minutes, that's 1 hour after the infusion. They just want to make sure that everything is fine, I am not reacting to it, before they send me home. So I waited for 1 hour, and after 1 hour they asked me if I was fine. My vital signs was also done and everything looks fine. Then the cannula was removed. The fetal heart rate was checked before. Immediately after the fetal heart rate was checked, the vital signs were rechecked again immediately after the infusion. Then they told me to wait for 1 hour. Then after 1 hour, the cannula was removed and I was asked to go home. So I didn't really experience those side effects, and I didn't really experience those risk factors associated with having an iron infusion. So that is what my personal appointment looks like when it comes to this iron infusion. So the last point I'm going to be sharing on this video is when to seek help. When to seek help after having iron infusion. The first one is if you are having iron overload. The signs that you're going to notice are joint pain, darkened skin, and abdominal pain. So if you notice that, kindly call 999. Depending on your emergency number in your area, call them or go to the doctor as soon as possible. Then if you still have this dizziness, you're still feeling fatigue after having the infusion, it's advisable for you to let your midwife or your healthcare provider know. Then also if you're having severe allergic reaction to it, such as difficulty with breathing, swelling, and chest pain, it's very important for you to let your healthcare provider know. So in summary, iron infusion is very good for a pregnant woman because iron is very important, because you have to increase your blood volume for the betterment of yourself and also for your baby. So back home, when an individual is having low hemoglobin or low red blood cells, one of the things they usually do is blood transfusion. Okay, so here they feel ion transfusion, it's important because some people react to some blood cells, some people are not comfortable having blood, but I think ion infusion is best rather than having blood. Yeah, ion infusion is actually best rather than having a blood transfusion. That's what I feel, and I think they're doing the job perfectly well because you have less reactions and less complications with ion infusion than blood transfusion, I would say. So that's it. Thank you very much for staying tuned. Thank you very much for watching this video, and I hope you got value from it. Don't forget to share, don't forget to like, and also don't forget to subscribe to our channel. Bye and see you in our next video.